Coordinators. My name is Jean Fettner, and I am the Director of Training here at OCHM. Just a heads up that this training is being recorded for future training and references purposes. By participating in this training, you are agreeing to being recorded. If you would not like your voice to show up on the recording, then you can just keep yourself muted and participate via chat. All right? So welcome again. Now, could we have the next slide, please? So we've got a group of trainers today. And like I said, my name is Jean Fettner. I'm the Director of Training. I've been in training for 25 some years, but in this job only for about 6 to 8 weeks right now. And I am absolutely delighted to be here today with you. Katie, you want to introduce yourself?
Yes, good morning, everyone. I'm Katie Webster. I'm the Manager of Utilization Management at OCHN. I've been with OCHN about 9 years now. I've been in Access and also UMUR during those years. So I am excited to be here with you today.
Thank you, Katie. How about Nida?
Good morning, everyone. My name is Nida Khan. I'm one of the PNT analysts. I oversee the SCD waiver, and thank you all for coming today.
Thank you. And I'm not sure Robin's with us this morning, but Robin, are you there?
No, I think Robin will be here for the next one.
I think Robin's going to be joining us for the next session. All right, so we go on to the next slide. And while we are going through the objectives, I'd like to have you introduce yourselves in chat. So if you could put in chat your name, where you're from, all right, and what your job role is, we'd really appreciate it. Thank you. So our learning objectives today are to really talk about philosophy, guiding principles of person-centered planning, understanding the role of care coordinators, learning how to write SMART objectives for individual plans, and learning ways to support each individual to achieve the goals established in their person-centered plan. We are going to have at least one break today. And for those of you who are interested in CEUs, we have social work CEs approved for this training. At the end of the training, I will be putting into chat, all right, the link to the evaluation. The evaluation is required for if you want a certificate of attendance or for a certificate of CEs. And at the bottom of the CE form, there will be a place for you to put in your license number and where you would like the CE form or your certificate of attendance sent to. All right. So moving on then, Nida, can I have the next slide? Okay. I'm going to turn it over now to Katie, who's going to take us into the purpose and moving us forward.
All right, thanks, Jean. So we wanted to start by talking about the purpose of person-centered planning today. So really the purpose is going to be looking at individual strengths. That's a big piece of what we're doing through the person-centered planning process. So looking at what are they good at? What do they like to do? What are some of the things that they see as goals for themselves or dreams for their future? And really being able to gather that information from them and from their family and be able to incorporate that into this process and make sure that that's at the forefront of what we're working on with them. Okay, and so kind of more on the purpose is to look at the individual in a different way, to assist them with gaining control over their own life, to increase opportunities for participation in the community, recognize individual strengths, desires, interests, and dreams. And that's a big piece of it we're going to talk a lot about today. And through a team effort, developing a plan that's going to turn into a reality for this person. Okay, so we're going to first go through definitions. So we listed out all of the definitions. I'll just kind of quickly go through them. Just these are all things that we're going to talk about and cover today. So person-centered planning or family-centered planning, we sometimes refer to it as PCP or FCP. Sometimes in our network, we refer to it as the IPAS, the Individual Plan of Service. and that is speaking specifically about the document. So for the PCP, it's a process for planning and supporting the individual receiving services that builds upon their capacity to engage in activities that promote community life and that honors the individual's choices and abilities. This process involves families, friends, professionals, anybody the individual desires or would like to have there and be part of the process. Fiscal intermediary, and fiscal management services. So an FI is an agency that handles an individual's budget. The FI receives the money in your individual budget from the mental health agency. When it receives a signed timesheet or invoice from the person, then it makes a payment to the workers and provides or providers of the services. The FI also handles all of the legal and tax aspects of being an employer for the person. Choice voucher system, a common way for youth enrolled in SED services to use arrangements that support self-determination. Through the choice voucher system, they may manage their individual budgets and directly hire workers with the assistance of an FI. Independent facilitator, so that's going to be a person that's not employed by the agency that serves the individual, that facilitates the person-centered planning process in collaboration with the person served. So we'll talk more about that and go more in depth on that today. Individual plan of service, which I reference, is the document created by the person or family-centered planning process. And then the golden thread is the process of ensuring documented, assessed needs and desires lead to specific goals and successful outcomes.
Okay,
Alrighty.
I'm sorry, Nada, because this training is very specifically designed for uh, the ICCW group, Nadal will be sharing with us some things throughout the training that are going to be a little bit different or are changing. So I'm sorry to have interrupted you, Nadal.
Sure,
Go ahead.
no problem at all. Good morning, everyone. As you all are aware, we are changing the RAP program to the ICCW, which is what it's going to be called Intensive Care Coordination with Wraparound. And these are just a little bit of refreshers. I know most of you are familiar with this, but the ICCW is an evidence-informed approach to ensure comprehensive coordination and holistic planning for the children, the youth, the young adults, and their families for this intensive need. Care coordination will include the organization, coordination, linkage, and monitoring of services and supports and advocacy on behalf of the child, youth, or young adult and their family. And then remember, with the wraparound principle, if there are other siblings, we usually want to wrap all of the family in that as well. Coordination and collaboration span across multiple systems, as you are aware, programs and resources in alignment with systems of care philosophy. And then wraparound is the individualized, family driven, and youth driven guided planning process facilitated by care coordinators that are trained in person centered planning process and certified in the wraparound planning process, which most of you are. And as you are aware, that they will be grandfathering everyone who's already a wraparound facilitator into the ICCW program. Alrighty, I think that was it for me.
All right. Okay, so we're going to talk next about the stages of change. We're going to move right into this. Some of you have probably heard of this model. And when we're talking about the stages of change, we're really looking at somebody's readiness. And so everyone has a different level of readiness, or they may be at a different place as far as where they're at in their treatment or with their readiness at different times. So this slide here shows the stages of change and the primary tasks. So in the first circle on the top, the dark blue, it's going to be the pre-contemplation stage of change. So the definition here is when someone is not yet considering a change or is unwilling or unable to change. So the primary task that the clinician or person working with this person would have would be raising awareness. So really helping them to kind of gain an awareness and an understanding of how some things happening in their life may be impacting their life and kind of helping motivate them to consider some change. The next stage is going to be contemplation. The definition here is that they see the possibility of change, but they're ambivalent and maybe uncertain. So the primary task here is going to be resolving the ambivalence, helping them to choose change. So really, again, using motivational interviewing and some of those techniques to try to help raise their awareness, as well as start considering and choosing that they want to make some changes. The preparation stage of change is next. So this is where they're committed to changing, but still considering what to do. They're still trying to figure out what action items might look like. And so that would be the primary task of someone helping them or working with them, would be to help them identify the appropriate change strategies, action items, and exactly how they can do that, what that'll look like, which will then help move them into the action stage of change, which is when they're actively taking steps towards change, but they haven't stabilized in the change process. So the primary task here is helping to implement those change strategies, helping them to learn to eliminate potential relapses, and working on preventing those things. The next stage of change is going to be maintenance. The definition is that they've achieved their goals, they're working to maintain that change, and the primary task here is to help them develop new skills for maintaining recovery. And then the last one is recurrence, or some of you may have heard it referenced as relapse. So definition would be that they've experienced a recurrence of the problems. So they were in the maintenance stage of change, and then some of those problems are coming back. They're starting to have some challenges with them. So the primary task there is to help them cope with the consequences. So whatever that looks like that's happened or occurred or is occurring, and then helping them determine what to do next. So kind of going back through the stages to help, raise the awareness again, help with getting them back to doing some of those action items and skills they were using for maintenance. So one thing I want to mention about the stages of change is just that it's not always going to occur in that linear circle that we see. It's always, they can move forward one, they can go back a couple. It's really going to depend on the person and where they're at, what's happening in their life. And so really, it's just important to meet them where they're at. It's not always going to be a fluid order necessarily. Okay, thanks, Nada. Okay, so we have an example. It's a scenario. So we're hoping that I'm going to read through it, and then if you can put your responses in the chat of what you think the appropriate stage of change is for this person. So Stephanie and her case manager are having a pre-planning meeting. Stephanie says she knows that when she gets sad, she avoids people, and it makes things even worse. She and her therapist have discussed different things to do when she feels less isolated. Stephanie agrees some of them might help, but she has not tried any of them yet and is not sure if she wants to. So which stage of change do you think Stephanie is in? And I know we don't have all the details when you're working directly with someone. You can ask questions and gain a little bit more information, but just based on that, what are your thoughts?
Go ahead and put those in chat if you have a thought. Hey, Doc, can you please go back a slide and show them what the options were again?
Okay, I see pre-contemplation, contemplation, pre-contemplation, contemplation. Give it another minute here. Contemplation. Okay, I'm not seeing anybody else type, so yeah, great job. I would definitely agree. I think contemplation would be kind of where she fits. I could see maybe a little bit of preparation too. And then, like I said, if you're working with this person, we'd be able to gather more information. But it seems like she's thought about it. She has some ideas, but she doesn't really have those, action steps that she can place. So she's kind of, I think, moving through contemplation into preparation. Okay, so we're going to talk next about the golden thread. So I like this visual because it literally shows you a picture of the golden thread. So I like to say that when we're talking about it and looking at these next slides to actually envision a golden thread, how it kind of links everything in services together and weaves through services. So this visual here, it's kind of showing us how the golden thread goes through the different parts of treatment. So the golden thread is going to start at, assessment when you begin working with the person. Really, anytime you're working with them and there's a need that's identified, that should be kind of flagged or noted as something that should be part of their treatment plan if they're open to having that. So, and how it'll be addressed is one thing that we'll talk about throughout this training as well. But so on the far left, it lists the IPOS. So this is when collaboration with the individual and the family occurs. You're identifying priorities for the person. The plan is going to be reflective of the needs that are discussed in the person-centered planning process. So we'll talk more about the process and how it starts with the pre-plan and all the different pieces and parts of it. But from there, the information in the IPOS should weave into the RAP plan. So coming up with a mission statement about what we will all be working on together, looking at the family's needs, coming up with several different ways to meet those needs that match up with our strengths, and then those should be seen in treatment. So the services should reflect the IPOS and what's been noted as a goal in the IPOS and what the person's needs are. The progress notes should then be linked to those goals and objectives. So as you're providing treatment and working with the person and the family, those progress notes should link back to the IPOS, and the services should reflect what's been authorized and what's noted in the IPOS as needed to help them achieve their goals. And then the action steps of reaching the goals in the IPOS. So that is where in treatment, you're kind of playing out those action steps of reaching those goals. Okay, and so the key with the golden thread in person-centered treatment is to develop a meaningful clinical narrative that follows the golden thread. So it's going to be collaboratively with the person, with the family, which can support engagement, person-centered treatment, medical necessity, and clinical appropriateness. So if it's identified in the assessment, noted in the IPOS, and then authorized, that follows the golden thread to show the clinical appropriateness and how they'll achieve those goals. And then maintaining an outcome focus. Okay, so this is a little more detail on the golden thread too, and I mentioned this earlier. It's going to start with the assessment process, so that might even be at intake or whenever an assessment is completed. So you're working with the person, gathering the assessment data, diagnostic formulation, discussing strengths and barriers, looking at their personal goals, their wants, needs, desires, and their identified needs. And then, so that information is going to carry over to be in the IPOS and the RAP plan. So that'll in, entail collaboration with the individual and the family, person-centered. It'll be person-centered. It'll identify priorities. The plan will be reflective of the needs identified during the assessment. So that is where the golden thread comes in, is that if it's identified in the assessment, it should be addressed in the plan if it's a need. And then in treatment, again, services will reflect the IPOS. Goals will be linked to the service notes and objectives. Um, Identified interventions will be in there, provided individual responses, and plan of action.
Katie, if it's okay, can I just add something real quick?
Absolutely.
So, everyone knows how for the specifically for the SCD waiver, Michelle does the assessment for that, and then it goes to a provider, and then provider does an intake. So the idea is that you are also looking at Michelle's assessment for the SCD waiver, because when the state does SCD waiver audits, they look at Michelle's assessment, and they look at the intake, they look at the RAP plan, and then they look at the IPOS, and they want to see a golden thread in all four of these documentations. So please do remember, do not neglect Michelle's assessment. Alrighty, thank you.
So we have a 5-minute break built in. Do we want to go ahead and take that now, Jean?
I think we
Do we want
can
to
hold off
keep
for a
going?
little bit.
Okay,
Yeah.
that sounds good. Okay, so we're going to move into talking about the person-centered planning process. So we will kind of go through each part of the person-centered planning process today. So I like this visual because it's a roadmap, but it shows the different kind of pieces and some of the key pieces of the process. And so it's going to start on the far left where the person begins thinking about their goals. And so that's where we can help them kind of have discussions about what some of their goals are, what some of their wants are, desires, and help them kind of consider and start getting prepared for this process. So that's where it moves into the second part where they're receiving information and education. So maybe that's from you as their clinician, maybe it's from, others or other professionals they're working with, but they're receiving information and education to help them kind of bring some of those goals into life. So the next piece is they're going to be gaining advocacy skills. So by receiving information and education, they're going to be getting, more information, feeling more comfortable. And then another key piece is just knowing that their input is valued. So really having these discussions, helping them feel heard, understood that these things are, the keys for the person-centered planning process. And that's what it all is around them and their goals, is where they're going to start to feel more valued and that their input is valued. And they may want to start taking on more decision making, and then eventually they're driving their own care with the support of you or family, other professionals, whoever it is that they want involved in the process. And then eventually they will be the sole decision maker with support. So this really kind of lays out the different phases of the process. But I also like that it shows it's kind of winding because it's, everything's kind of a journey as we go. Okay, so these are the different parts of the PCP. We're going to talk more about each of them. So the assessment, the pre-planning meeting, the individual plan of service or IPAS meeting, crisis plan, periodic reviews, amendments, authorizations, and then ongoing review of goals and progress. So we're going to talk first about assessments. And we did list them and kind of define all of them just so we could start here. So the Michicans, this first we're going to talk about the Michigan screener, which is required at access for all infants, toddlers, children, youth, and young adults ages birth through 20 years old or the day before their 21st birthday to determine potential eligibility for behavioral health services. The next one is Michigan's Comprehensive, which is used at intake with children, youth, and young adults ages birth through 20 to help determine eligibility. The DECA is required at intake and treatment planning for infants, toddlers, and children ages 1 month through 5 who have either an SED or an SED and IDD diagnosis.
I'm so sorry, Katie. Can I add one more
Of
thing if it's
course,
okay?
yes, go ahead.
So as you are aware for ICCW in our system, you are not required to do the Michicans. But it is going to be your responsibility to ensure that the therapist or someone else at your agency is administering the Michicans. So that is going to fall on the ICCW care coordinator to ensure that the Michicans is completed.
Thank you. Okay, and then pre-planning. So pre-planning is that meeting before the IPAS meeting when you get a game plan for all of these things listed on the screen. So who would you like to attend your meeting? Where would you like your IPAS meeting to occur? When would you like your meeting to occur? What would you like to talk about and not talk about at your meeting? Who would you like to lead your meeting and take notes? And then it also is time to give an opportunity to discuss strengths, needs, and goals that will then be incorporated into the IPAS. Okay, so looking at who should attend a pre-planning meeting, it's going to be the individual served, their case manager, supports coordinator, anyone working with them, their family members, parents, guardians, friends or advocates if they want them to. An independent facilitator, which we talked about, is someone who doesn't have any of these other titles, that they might want somebody separate to run their meeting. They could have their direct support professionals involved, or really anybody that they want to attend. So it's really up to them. And anybody they would want to attend, it could be, friends, it could be somebody from church, could be anybody. And so that's an important piece, is making sure that there's, opportunity given for those people to be involved. So looking at calendars, sometimes if there's a lot of people, it might take a lot of coordinating to figure out a time that works for everyone, but just making sure that that's an option. And so where does it take place? Again, that's going to be up to the individual. This meeting is more of an informal meeting. It's a smaller meeting than the IPOS, but it could take place in the community. It could be virtual, could be via phone, really wherever they feel most comfortable and they prefer to have it. Okay, and when does it occur? So it takes place, ideally it should take place at least 1 to 3 months before the IPOS meeting to allow time to coordinate schedules, like I mentioned. It could be after hours, it could be within a workday, but the flexibility really should be there, just so that it can be any time that works for all of the individuals that would need to be involved. And if somebody, I just want to mention too, if somebody is brand new to services, then the time frame would look a little bit different. So they could have a preliminary IPOS, or the pre-plan could be done right away, but just wanted to mention that about the time frame. But ideally, it should take place 1 to 3 months before the IPOS meeting, because people need to reschedule, or if something comes up, we really want to make sure that the IPOS is done timely and that there isn't a gap between when the last IPOS expired and when the new one is in place, if someone's been in services. So that's another key piece. Okay, and what to talk about, what not to talk about. So at the pre-planning meeting, like we said, we're going to talk about the who, what, where, when, who will lead the IPOS meeting and take notes. So you're really planning for that IPOS meeting to make sure when it's time to have that meeting, everybody's prepared, there's a plan in place, and you can move right into it. Also discussing various waiver services for which the person might be eligible and letting them know. So this is the point where you're discussing that, letting them know what they're eligible for. Maybe they're not eligible, but it has to be addressed what they're eligible for in terms of waivers. And independent facilitation. So this is another time when you'll inform them and educate them on that option so that they will know that that's an option. Sorry. Okay. I was getting some feedback. I think it's all good now. And then also discussing that they have the right to choose among qualified providers and the process by which they can choose a provider. And then also self-determination and or choice vouchers. This is the time to discuss that as well. Let them know what those are and what's available to them, and have the discussion with them so they can make informed decisions. And then also this is the opportunity to discuss strengths, needs, and goals, and anything from their assessments as well. If there was anything identified, starting those discussions now is helpful. Okay, so who leads the meeting? That could be the individual served, it could be the care coordinators or anyone working with the person, the independent facilitator, could be a parent or a guardian if they choose that, or it could be co-led with 2 individuals. And maybe the person served wants to start to lead the meeting, but they would feel more comfortable having someone assisting, and then eventually they'll take it on. So really can be creative with whatever they're looking for this to look like. Okay, so we're going to move into a video. So I'm going to go ahead and mute. Nada will let you know if we can't hear it, but I think it should be okay.
The sound good?
Person-centered plan brings together all the stakeholders in the individual's life. It is a process that illustrates beautifully in color the skills and interests of the person. It includes community, it includes employment information, it includes family information. It just highlights all the things that are important to the person. And then it helps narrow down information so that the employment consultant can get really focused on tasks and types of industries so that by the time they're exiting the transition program, they have great gainful employment.
We decided a person-centered plan would be important. I'd heard about it. I wasn't really sure what it was, but I kind of heard about it and thought, you know, this would be a good idea to check into, and really it is, it helped us focus on what his dreams, what his goals, what his ambitions were. Got together important people in his life, and I think it kind of gave us an idea of how to move forward from being a teenager into adulthood, which is kind of a scary thing.
A person-centered plan and discovery really go hand in hand together. The exploration process ties right into all the things that have already been mapped out for the student that highlight the skills, interests, so it really helps narrow down the process for the employment consultant that then is going out to the field to find that paid position for the person.
I feel I can do this.
Yeah, and you did it.
Yeah.
Right, here you are.
I understand the plan, and it helps me conceive the good goals and help me get a job and help me my life, and it helped me anything.
So what'd you guys think about Andrew? If you could put into chat, what do you think are some of the things that, or what do you know are some of the things that the people that you work with have been working on? Yes, I'll give you a minute and just think about that. What have other people been working on as part of the person-centered planning process? Terry, thanks for joining us. So let's see if we can get some ideas in chat. What are things that people are working on as PCP goals? Graduation. I'm thinking, is that high school graduation, Marissa? Okay, so working on graduation. What else do people? Social skills, okay. A lot of people, I know, I used to be the rights manager, and there are a lot of people, I looked at a lot of IPASs, people had social skills in there. Oh, anger management. All right, Terry was sharing anger management. Marissa says health and wellness. Oh, getting your driver's license, that's a big deal for teenagers. Absolutely. Community involvement, possible employment. So we've got the full gamut here. We've got everything from health to skill sets, to major goals, graduation, getting your license is a major goal. Self-esteem, that's a good one too, all right? So thank you for sharing. So when we look at the person-centered planning process, there are a lot of different things that people can put on their PCP as wanting to work on, all right? And it's our job to try and help them figure out how to do that. So thank you for letting me bounce in there. And I'm going to go ahead and turn it back over.
All righty. So Pretty much similar, exactly the same to what Katie has mentioned. So the ICCW requires timely planning given the intensive need of the children, youth, young adult, and families. And then ICCW will be utilizing both the wraparound planning process and the person-centered planning process. The wraparound planning process is to be provided to the MDHHS model fidelity, and the person-centered planning process is to be provided to the MDHHS policy, including the family driven and youth guided policy. And then there is the safety slash crisis plan, the wraparound plan, and the individual plan of service are the resulting plans from the utilizing of the wraparound planning process and the person centered planning process. So simultaneously, care coordinators will integrate the person-centered planning process to facilitate the development of the child, youth, or young adults IPOS. The wraparound plan is to drive the development and or adjustment of the IPOS, and the care coordinators will complete ongoing updates to the wrap plan and annual updates to the IPOS.
Okay, so now we're going to move into talking about the individual plan of service meeting. So this is the meeting we've been talking about. At this point, we would have done some assessments. We would have had the pre-planning meeting. Now we're here at the IPOS meeting. So really, we're thinking about what needs to be in the plan to help them be successful with achieving their goals. So it's best if there's a clear and shared appreciation of the talents and capacities of the individuals served. So that also goes back to the pre-plan when we talked about their strengths, their desires, their hopes, dreams, all of those things. It is helpful to have a common understanding of what the individual served wants and then agree to meet regularly to review activities. So formal and informal ways of reviewing that, and we'll talk about that more too and how that's done throughout this process. Okay, so during the IPAS meeting, providers and individuals, families served collaborate about support, service, treatment needs, obstacles or barriers if there are any, goals and progress. It ensures that the individual and the family members served are heard and understood. This process does. And then the IPAS accurately reflects the goals, dreams, desires, and wishes of the individual and the family. So that's another key piece we're going to talk about more today as we talk more about like SMART goals and writing the goals, but just really making sure that it reflects exactly what they're looking for and how they want it to be. So this is really meant to be a collaborative process. It should be coming from them, in their words in collaboration with, you putting it into goals and onto the paper. Okay, and so the process also embraces the individual's response, reinforcing that there's no right or wrong answer. It acknowledges and respects the perspective of the person and the family served. And the PCP really creates an environment in which the individual and family served knows that their feedback is encouraged and respected. So we want them to feel that this really is their process and this is their plan, and we're here to help them, put that into a document and put their goals down into something that can be achievable. Okay, so periodic reviews. We talked a minute ago about formal and informal ways of reviewing their plan. So periodic reviews are a way that will review the IPAS, and the purpose of periodic reviews is to review the overall appropriateness of the IPAS based on the changing needs and priorities of the individual and the family. So these are scheduled in advance and conducted using the person-centered planning process. And an individual or their guardian can also request a periodic review at any time. So your organization would specify like how frequently you're doing periodic reviews, but they can be requested at any time. Anytime the family feels like their needs or their priorities have shifted or changed and they want to make an adjustment, then that can be done. Okay. And so the periodic review includes reviewing the continued relevance of the outcomes and the goals. So during this, you would look at the goals to see where are they at with achieving them. Maybe they've met a goal, so it can be discontinued, or marked as completed, and they can move on to replacing it with another goal or focusing on the other goals that they have. So there may be some that maybe they're no longer interested in and they need to be removed because of that, or anything else that could have changed. These can be adjusted or shifted to account for that. And then you're also looking at progress towards each goal and objective in the IPOS, so where they're at with it, and then kind of reassessing from there too. Are there barriers? What's happening with their objectives and what they were using as action items to try to achieve these goals? Are they still appropriate? Maybe something different needs to be added, or something else is needed. So this is the time to kind of look at that and see if a shift needs to occur. And then also looking at strategies and interventions for continued movement towards goal achievement. So I talked about that a little bit, but just making sure that those strategies and interventions are still the most appropriate, or maybe there is a change that would be more helpful. And I see your question in the chat, Michelle. So are there any rules related to how often periodic reviews must be done? So that would be up to the organization. Some organizations do them every 3 months, some it's every 6. And I would have to reference, we have an individual plan of service protocol. That protocol will tell us, we'll talk towards the end of this training about where to find that. That will tell us how frequently they need to be done. And I don't recall offhand. Lisa, our UM supervisor, is on here. If she knows, if you know, feel free to add it to the chat. But otherwise, we can get that information and share it with you. Okay, you're welcome. All right, so now we're going to talk about amendments. So amendments are another way that you can change the plan. And so for these, there's not a rule for these. Okay, I see Lisa's answer in the chat as well. So minimally every 6 months for the periodic reviews. That was what I was thinking, but I wasn't sure. And so in conjunction with the benefit plans. So the benefit plans should be updated at that point too. But for periodic reviews, it's minimally every 6 months, and then whatever your specific organization requires. Thank you, Lisa.
You're welcome.
Okay,
No
so
problem.
So amendments, like I was saying, are another way that we can modify the IPOS. So this is going to be, again, in response to changes that the individual or the family prefers or needs. They can make changes as needed whenever the person requests or, would like to make a change, or whenever there's a reason to modify it. And one thing I want to just note, so amendments are also needed like when there's a change needed to an authorization. And so amendments should always be, they're part of the person-centered planning process, so they should always be done in collaboration with the person and the family. So even if it's just an auth change, you still want to have a discussion with them, kind of let them know what's happening and see, if there's other preferences or needs that they have. In UM, sometimes we'll see IPOS amendments where it just notes like adding auths and that's it. So we really look for those discussions to have occurred so that the person is aware of like any change that's being made, and because it's their person-centered planning process, we want to make sure everything's done in collaboration with them. And then amendments to the IPOS can occur at any time during the provision of services when a new need or a change in the individual or family's needs arises that must be addressed. So another reason we might do an amendment would be if there's a hospitalization, if there's a change in level of care, or if there's any change that's needed to a goal or an objective, something like that. Any change that's needed, this is the way to do that. Okay, so this kind of reiterates some of that. I'm just going to list some of the examples of when an amendment might be needed. So that could be to terminate or suspend authorization. So maybe their needs or their goals changed and they no longer need a service that was authorized. That could be voided or maybe early terminated or suspended. To add or change a goal or an objective, and to authorize a new service. So to add authorizations to a current goal or objective, maybe they use their authorizations and used more than what you kind of anticipated with them that they might need to meet that goal, and now they're needing more, or they may need a new service altogether to help them achieve their goal. And when there's a hospitalization or when there's a change in level of care, and then again, anytime the individual or family would like to make a change. Okay, so we're going to talk more about authorizations now. So authorizations are part of...
Katie, can
Go
I
ahead,
interrupt
Jean.
you?
Absolutely, yep.
Yeah, before we talk about authorizations, I'd like to just say a few things about person-centered planning, if I may, to my co-presenters. One thing that we are not covering in this training in depth, we have a 6-hour PCP training where we do a deeper dives into some areas. But I want to comment on the real importance that we work with families and we work with individuals served. I spent a lot of my years working with kids and families as well as with adults, and really helping them delve in depth into what is it that you want to achieve, not only as an individual, but as a citizen, all right, as a member of a family, and all the various roles that we play. All right. It's very easy when we look historically at what's happened to people. All right. We have superimposed goals that we think are important on individuals. All right. Oh, and children will tell you all the time, what do you want to do? I do what mom says. All right. And so we've really have a struggle in helping people find their voices. So if we look back, for example, at person-centered planning, all right, we can do this, and we can do this very boring. We can sit at a table, a kitchen table, and we can talk, blah, 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 and all the grown-ups get to talk, blah, blah, blah. Think about Charlie Brown's teacher, all right? And all the adults are talking, and we've got a kid, a child, or an adolescent sitting there who does not feel like they have a voice at their meeting. And it's a struggle for us to help them find their voice, right? And help them express what it is that they choose. Because mom might say, he's got to get his behavior under control. And grandma might say, he is so rude to everybody, and he needs to be more positive, and he needs to be more polite. And so think about sitting at a meeting where you may feel attacked, all right, where you may feel there is no voice here. And so one of the challenges that we've always had with wraparound services and with any child and adolescent services is really helping that individual have their voice. And sometimes the voice comes in a private meeting, not in a group meeting. All right, not in a meeting where you're feeling like everybody is telling you what to do. And the other thing that we need to remember is that when we're working with young people, their center of gravity, their reality, all right, is the here and now. They don't have the wealth of background that the adults sitting at the table have. All right, they're not bringing experiences to them. And so we very often need to talk about give them some insight into the experiences that they may have coming, but they haven't experienced yet. So, for example, talking with a 16-year-old who has never in their life paid rent, doesn't know about utilities, and says, hey, I'm going to get my job, I'm going to get myself a house, and I'm not going to live around here. I'm going to live in, West Bloomfield. All right. And basically, having some of those insight conversations. Oh, so tell me more about what your house, not tell me more about what your house is going to look like, or your apartment. Not, you can't live in West Bloomfield. You don't have a job. All right. And you don't even know, you couldn't even pay the rent. So we can come at this from negative, and we can come at this from positive. All right. So tell me about what your place is going to look like. Well, I'm going to have my own bedroom. All right. So, and I'm going to have a kitchen where I can use the microwave whenever I want. All right. And so you start listening to what adolescents and children express as their desires. All right. What's the outside going to look like? It's going to be on a quiet street. All right. and there's not going to be any shouting and screaming and yelling. All right. People are going to behave themselves. All right. And when I go out for a walk or I go out to ride my bike, I said, it's going to feel good. What does feeling good mean like? It means that it's going to, I don't have to worry about somebody coming up and trying to shove me or rob me or anything like that. And when we listen to the stories, as opposed to negating them, when we listen to the stories, all right, we really truly find out what the individual is looking for. They may have driven through West Bloomfield and seen elements of what they're looking for right there. But the fact is that what they're looking for is a place that's private, where they can have their own room, where it's quiet, where they can go outside and ride their bike, all right, where people are not shouting during the night. We can find that. We could, for a 16, 17, 18-year-old who's on the verge of, transitioning into adult life, we can help them find that. All right. And it's not really about West Bloomfield. It's about what they're telling you is that's where I've seen it before. How can I find that? How can I locate that? All right. As very similar. Well, I want a job. All right. And I want a job and I want to work in a hospital. All right. I want to work in the hospital. So then the adults in their life go, well, that's a great dream, but you know what? You're not college material, so you're not going to be able to work in a hospital. All right. And, very often with the kids that we work with and the adolescents we work with, the negative messaging has been there for a significant part of their life. All right. And so really, instead of saying, you can't get a college degree, well, tell me, what is it that you want to do in a hospital? I want to help people. All right. I want to be there for them. I want to be able to walk in their rooms and say, hi, how are you today? And that doesn't have to be a doctor or a nurse. That can be a volunteer. Okay. That can be somebody who's got a CNA. So how are we going to start you off? All right. How are we going to start you off and being able to fulfill your dreams? Right. And so, one of the things that I always think about is how do people find their voice? And I just want to share with you some things that my family member did. I had a family member, her name was Mary. She passed 2 years ago from cancer. It's hard to believe it's been 2 years. But we used to have her person-centered planning meetings at her home, all right? And because she had her own home, her own condo with her own bedroom, all right? And she loved her home, all right? And she had a developmental disability. And very often it was easy for people to talk over her. And so what I did early on was I brought flip charts, sticky note flip chart paper to meetings. And I brought a bunch of colors to the meeting. And I said, everybody needs to pick a color. And here we're talking about Mary. We're not talking about you. We're talking about Mary. All right. So everybody now, we've got a big sheet of paper that says goals on it. Everybody now think about one thing you'd like Mary to be able to experience in her life. We didn't use the word goal. And everybody would walk up and you could tell who wrote it by the color of their marker. And Mary always picked purple. So Mary would walk up and she was able to write and she put a few things on there. And then I would tell her, Mary, look at the things that other people wrote. Put a circle around the things that you think are good ideas for you. And so Mary would walk up and besides the 2 things that she wrote up there, she'd circle 2 or 3 more. And that gave her the opportunity, all right, to express an opinion, all right, without having to verbalize it, without having to speak up. Because at Mary's PCP meetings was 3 or 4 members of my family who are all very outspoken women, all right, plus a bunch of professionals, and of course her supports coordinator, all right, and who she felt very comfortable with. But trying to find a mechanism by which Mary had a voice was always very, very challenging. And I wouldn't mean, what do you think about the thing that Aunt Lori put up there? Aunt Lori said riding the bus. No, 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 riding bus is scary. Don't want to ride bus. Okay. And Aunt Lori, by the way, is my mom. All right. And basically saying, but you said you want to go to the ball game and you want to go here and you want to go there. What better way to get there than is on the bus? And you don't have to ride the bus by yourself. Are you willing to try to go that way with Sarah, who was her staff person? You willing to give it a try? As opposed to, well, you know what, being scared is really dumb, Mary. There's no reason to be scared to ride a bus. Sure there is from her standpoint. And so I think that when we talk about person-centered planning and we're having meetings and we're talking about amendments, because one of the things that I've always told Mary, okay, is that, you know what, Mary, if it doesn't work out, we can cross it off the list. All right. AKA for us, it's an amendment. We're going to add, or if you discover something else, we can add it. All right. And helping her understand that this is not something that's written in stone. And one of the things that my family did is that we had a ceremony at the end where the flip chart people was rolled up and tied with a purple bow. And it was handed not to her supports coordinator, not to her psychologist, but it was presented to her as her plan. It belongs to her. And trying to help her understand that this belongs to you, not anybody else. And the supports coordinator would go, hey, can I get a copy of that? I go, you've got a camera, take a picture of them before we roll them up. So the supports coordinator would take pictures of all the different flip chart papers that we've had. She knew who talked about what based on the color of the ink on it. All right. And Mary walked away with her iPods. So beyond all of the stuff that we've talked about today, really helping people fully participate and find their voice is a very crucial element. If the kids that we are working with today don't find their voice, then as adults, it's very likely they're going to continue to receive services in our system. They will not have their voice. All right. So I challenge you to think about, how are people finding their voice? Right. So thank you for listening to Jean's little spiel. I teach a lot of person-centered planning from various angles, and we can, I can teach a 4-hour class just on how to have really good meetings with families. All right, different approaches to take. Right.
Okay, sounds good. So, all right, we're going to jump into the training again. We're going to talk about authorizations. And so this is another piece of the person-centered planning process. I think sometimes we may not always think of authorizations as part of that, but they are linked directly with services that are included in the plan of service and help bring those goals and objectives to life. So authorizations are needed once the individual and the family have agreed on what services they want, who will be providing the services, and how often or how much services are needed. Authorizations reflect the services in the IPAS and can be adjusted at any time to coincide with the services in the IPAS. So authorizations are part of the golden thread as well. They should reflect the needs identified during the assessment and the PCP process. And when authorizations are submitted for services, A determination for the authorization request must be made within 14 days of the date the request was received. So that also goes for when services are requested by the family or the individual. A decision must be made within 14 days of that date. And so we do have a process for extending that time frame. So if a service authorization request requires more time or further review or assessment to determine if it's clinically appropriate, then a service authorization extension letter can be issued, which allows another 14 days for that decision to be made. So those service authorization extension letters are available in the electronic health record in Odin on the person page. So we have them available for the core providers. It's going to be when you click on the person tab, it'll be all the way at the bottom in Odin on that page. And then you can add a new letter and it pulls up a template that's kind of pre-filled. You just add in the different dates and the applicable information and then can print it to provide to the family from there. So the benefit plan determines the array of services available according to the level of care. A benefit plan should be updated when there's a change in level of care or at least annually. So if there's not a change throughout the year, then once a year the benefit plan needs to be updated. Might end up being the same benefit plan, could be different, but a new one is needed at least annually. And staff must ensure that the benefit plan worksheet is current, updated, and signed prior to creating the specialist review or authorization requests. So the benefit plan has to be in the system before the authorizations are added because Odin looks at the benefit plan worksheet to see what's available in the benefit plan. And then if what's being requested is within that benefit plan, the authorizations will auto approve. If they don't or they're above that allowed amount, that's when it comes for a specialist review to OCHN-UM. And so if that benefit plan isn't in there, isn't signed, or isn't complete, we'll automatically send those authorizations back so that can be done. So that's just a little trick to smooth out the process a little bit. So specialist reviews take place when an authorization is requested. So there's a couple of different reasons. If services are not within the pre-approved benefit plan, so if it's a service that's just not offered altogether and the person needs it, not offered in their benefit plan, and the person needs it, that can be requested. It wouldn't auto approve because the service isn't in the benefit plan, and it would come to OCHN-UM for review. The other time that it would come to us for review would be if the services exceed the limit of the benefit plan. So if the type of service, the amount, the duration for that determined level of care is above what's allowed, then it would automatically come to UM as well.
May I add something, Katie, if it's
Yes,
okay?
Nada.
So most of you are aware this does happen a lot with our SCD waiver cases. So since the role for ICCW is a little different and you will be overseeing the IPOS part as well, I would really highly encourage everyone, not just the ICCW supervisors, but as well as each care coordinator, that when you are in Odin and you look at the chart with the person tab, on the top of it, you can see what level of care the child is in. And we always want to make sure that they are in the appropriate level of care specifically for SCD waiver, because if they are, then a lot of the stuff that you are authorizing for should probably be okay. But if you are in an incorrect level of care, then it will end up going to a specialist review because it's going to be above and beyond. And for some of the SCD waiver services, it is automatically going to go for a specialist review because that's just how we have our system. So if it's like, for example, I think the camps, or if it's like above and beyond CLS and respite hours that the family is requesting, then it will automatically go to a specialist review. And it's very important that for specialist reviews, you are putting the medical necessity. Please do not just say, it's an SCD waiver case. Like, we know it's an SCD waiver case, and that's why they're needing the extra need in the services, but we would like to see some sort of a clinical rationale. Katie, did you want to speak to that? Because I know you all end up sending a lot of them back if they don't have the appropriate clinical rationale written in it. And since this was mostly handled by the clinicians with ICCW, this piece is going to be handled by you guys moving forward, or the ICCW team. So please, I wanted to make sure that you are familiar with this portion.
Yes, thank you. And that's a great point. So that is very important with authorizations. So the provider notes section is where we look for the clinical rationale that Nada was talking about. So we really look for it to be specific and individualized and detailed about the person. So what their needs are, why they need the service. Often we'll see just kind of generic information like describing what the service is and that the person needs it. And it doesn't really go into detail about why they need it, how it'll be helpful for them, what would happen if they didn't receive the service, those types of things. So that's always a reminder we like to give because we see that pretty often, that it's just kind of a summary of what the service is, but we really need to know more about the person, what's happening and why they need it specifically. So I think that is a helpful piece of information. We UM did some trainings and we have some recorded trainings, and the PowerPoints are in Odin under that help tab. We did it specific to population. They're a couple of years old. There's a couple of things that need updating, but the majority of it is still current for like the specialist review process, entering authorizations, the clinical rationale, all of those pieces that are required. So there are 3 of them in there, one for SED, one for IDD, and one for MI. So please feel free to go in there and check them out. If we'll give you our contact information at the end, if you need any help finding them or anything, we can help with that. So just let us know. And then also our analysts, do email outreach and try to coordinate on what's needed as well as we go through this learning process for all of you. But that's definitely an important piece, the clinical rationale. And this flow chart is going to kind of give you an overview of how person-centered planning links to the authorizations, your role in it, and then kind of what that looks like. So if we start in the top left in that box, that's going to be the person-centered planning process. So that's kind of the beginning of this. And then authorizations for those service types and amounts are going to be requested based on the discussion that you have with the family and based on what their goals are. So you're going to be figuring out with them, okay, what needs to be authorized and what amount, scope, and duration to make sure that these goals can be met and to help them achieve them. So once you determine what needs to be authorized, then you're going to be looking to decide or determine if these services are Medicaid covered services per the Medicaid provider manual. If they're not, then that would be a benefit plan denial completed by the core provider agency, and there would have to you would assist them with what other options are available, what community resources, where they can find that service they need. If it is a Medicaid covered service, then you would be looking to see if it's in the benefit plan. So is that type of service and the amount in the benefit plan? And if yes, then you would put in the authorization and it would auto approve in Odin or in the system. It'll automatically approve and the services will be in place for the person immediately. If it's not a Medicaid or a service that's in the benefit plan, the type or the amount or the duration of it is longer than the benefit plan, you can put the authorization. Well, the next step is going to be to decide if it's clinically appropriate. So if not, then that would be a benefit plan denial also done by the core provider. If it is, then that's when you're putting that authorization in, and it's not going to auto approve because it's not within the benefit plan, but it'll come to OCH and for review. So that's what we call a specialist review. We just sent out a bulletin last week. We're changing the name of specialist review. It'll just be a review, just to kind of simplify it. Everything that comes to will be a review. So that will be what that process looks like. And then Odin will automatically route the auth to OCH and We will review it. If we find that everything we need is there and it's clinically appropriate, we would approve it. If we're missing some information or more information is needed, or maybe we need documentation updated to be able to make a decision, we'll return the authorization to you. So we return it in Odin. You should get an alert and an email letting you know it was returned to you. In the language in that says, an authorization has been returned/denied without approval, something like that. It doesn't mean that it was denied though. It just means it was returned and we need you to take a look at it and send it back. I know sometimes people think it was denied, it's done and over, but typically it's returned and our time, that 14-day clock is still ticking. So we need you to take a look at it and send it back. And then, like I said, if you have questions, if we can help support you, you can reach out to the person working on it. Okay, so this is kind of to wrap up the person-centered planning process discussion and the authorization piece, all of it, but it's really an ongoing process all year long. So you should be always discussing the progress with the family and the individual. Someone may complete a goal, they might want to add a new one or decide that they want something to change throughout the year. So really, it's their document. It's up to them to make those decisions. So we're here to support them in that, to help make those adjustments to the document as they need to. And that's the one thing I think we want to highlight with this slide is just that it's not just one IPOS meeting and then it's done. It's really an ongoing process throughout their treatment, and it's ever changing as they need it to.
Alrighty, so as you are aware that we only have one code now, which is the H2021 for ICCW. For either one, whether they are using the ICCW RAP plan or they're not using the RAP planning and they just want to do the case management piece, that's the only code that we have that we will be using. And this is also the code for ICCW for SCD waiver and non-SCD waiver cases. The targeted case management cannot be authorized when ICCW is authorized. And I don't think we really use targeted case management in the SCD system of care that much. Children, youth, and young adults can receive home-based services and ICCW concurrently, but case management function through home-based services may not be billed at the same time when ICCW is also billed. And then these are some of the ICCW documentation. So on the left side, you see the list of items that you are probably familiar with and have been doing them for, many months, years, and all of that. The safety planning, the mission statement, the plan, the team meetings, the transition plan, the graduation summary, the strength narratives, and all of that. So those are going to be not necessary because the new ICCW documentation that needs to be in Odin in our chart, in our records, is the safety/crisis plan, the wraparound plan, the IPOS, the team meeting minutes, and then the graduation summary. So there's a lot less documentation requirement for ICCW. Alrighty, over to you.
Okay, thank you to both of our other presenters. I'm going to start now on SMART objectives, and we're going to go through this. We'll probably take another short break, and we're going to do a little bit of breakout in this section. And I'm going to start off by just talking a little bit about objectives. All right. Now, we've already covered in this class that the goals and objectives really need to be about the individual and what he or she wants as well as their family, because we're talking about kids. All right. And when we think about the idea about setting objectives, forgive me for using this word. Most of us are, I'm not even going to say it, most of us S at it. Okay. We just are not good. We suck at it. All right. Because we don't spend a lot of time thinking about our own goals and objectives. So when I do an introduction to person-centered planning in my college classes, I look at my students and I go, I want you to identify one goal that you have for next year and 3 goals that you have for 3 years from now. And they look at me blankly. All right. I said, what do you want to have obtained? And it usually takes them no less than 45 minutes to come up with a goal plus 3 years, three-year goals. And it's just not an intuitive process. And so why we think that families and kids and that should be able to identify 3 goals immediately, all right, um, is a little bit of a disservice to them. Now, most of the time we've been working with these families for a while, all right, and we know the things that need to happen. We sort of intuitively know. But intuitively knowing something is not the same thing as it being a goal for someone. All right? When we think historically what we have done with goals and objectives related to person centered plans or IPOSs, individual plans of service, we have, quote, assisted people in identifying their goals. So, very likely, okay, if we go back maybe 20 years, and somebody was living in congregate living, like a group home, and they might have on their person-centered plan, uh, Josh wants to be healthier. Josh will go from smoking 2 packs of cigarettes a day to 2 cigarettes per day within the next 3 months. And then when you talk to Josh, Josh goes, I never said I wanted to give up cigarettes. That's not what I meant when I said I'm being healthy. So somehow, somewhere, somebody infused an opinion into Josh's plan. All right. Or we've done things like, you know what, you're overweight. You need to lose weight. So therefore, we're going to put you on a 1,200 calorie a day diet so that you start losing some weight. And so meanwhile, the adolescent or young adult is looking at you going, yeah, you know what? I'm not sure that that's my goal. Right? So very often we superimpose goals and objectives that are things that we intuitively feel that need to happen, but are not necessarily the goals of the individual. You know, one of the things, I am the mom of a young adult, and it surprised me when she was growing up how many times within her friendship circle the F bomb was dropped. F this and F that, and oh, he's such an F'er. All right. And when I was a teenager, that was absolutely positively not allowed. But when I listen to teenagers today, all right, they talk different than we do, the rest of us do. All right, those people in my generation, maybe yours too. All right, and we need to make sure that what we're asking people to do, all right, is really a choice that they're making. Right. So we can say you're not allowed to use the F word at home. All right. But the fact is that we can't keep them from being exposed to that. Right. So when we think about objectives and our own struggle with determining what they want, I know 10 years from now, I want to be retired. That's my primary goal. I want to be retired, not starting my retirement. I want to be retired. But I know that there's a number of steps that come in between that. So I'm going to challenge you right now to go into chat without divulging anything really personal, okay? That's not what I'm looking for. But I'd like you to think about 1 year from now. Let's go with 10/1/2025. What is one thing that you will have achieved? A goal or an objective. One thing that you will have achieved. So I'm going to stop talking and give you a minute to put it in chat. Right? And I'm going to do my own too. Okay, so we've got some people. Keep writing. Move into a new apartment. Finish my MSW program. I will know how to better administer the Michigans. I want to be planning my next big out-of-country trip by having decided on the location and the timing. Going on vacation. Right? So we've had a number of people read 20 books. Love that, very measurable. Moving into a house and out of my apartment. Okay? So when we think about starting my internship, when we think about objectives and goals, right, we need to remember that, once again, as I said before, these things are often based on having had experience. If you had asked me when I was 16, what are your goals for when you're 26? I would have said, I want to have a job. All right. Don't know where, don't know when, don't know why. I just want to have a job where I can make some money so I have spending money. All right. So for us, as well as for the individuals we work with, having a goals and objectives are oftentimes based on the experiences that we have either already had or that we haven't had. So helping people understand what it is that they truly want, as my apartment example, where you want to live example, back about a half an hour ago. All right. Now I don't want an apartment in West Bloomfield, but I want an apartment that's quiet, on a quiet street where it's safe and I can ride my bike. All right. And delving in depth. So very often people need us to help to tease out those goals. All right. So one of my favorite wraparound goals, and I worked in wraparound over 20 years ago. All right. And I was simply a supervisor who happened to have that program underneath in my belt. All right. And mom goes, I just want him out of the house. Kid was approaching 18. All right. And so we had a lengthy discussion. All right. And he screamed back at his mom, and I want to get out of this effing house too. So we basically were able to redirect people, and we talked about everything that needs to be in place before he can genuinely move out. And that was a very difficult discussion, right? So mom wasn't about to just throw him out the day he turned 18. Dad was there. Dad was, the second you turn 18, you're out of my house. But mom wasn't, even though she knew that she wanted him to move. And he knew he wanted to move, but he wasn't sure exactly what he was going to do. All right. So therefore, we need to be very, very cognizant of when we are helping people set goals, making sure that they are actually achievable, all right, for them. So one way that we can do that is we can, once we have an idea in mind, we can write a SMART goal or a SMART objective. All right. What does that mean? They're goals that are SMART, they're meaningful to the family, and the objectives are written in a format whereas everybody knows, okay, how close we are to getting this done. All right. So when you think about the ones that you just put in the chat for your own life, if I were to ask you, and I'm not going to break it down, my goal was I want to be planning my next big out of country trip. And the things I want to have done by October 1st next year is I want to have decided on the location and the timing, where we're going and when we're going. All right. So this time last year, I knew that in February 25, I'm going to Australia. All right. Since then, a lot of other targets have been met. But last year, that's all that was decided, where we're going and when we're going. And since then, we've set other goals, other objectives. All right. So SMART objectives are not only meaningful to what the individual and family want, but they're also written in such a way that everybody knows how we are approximating that. One of the things that I do as a side job is I am a surveyor for a company called CARF. And I travel a couple times a year and look at different programs that are around the nation. And I love it when I go into programs and I will ask individuals, how are you doing? What are you working on? And they look at me and they go, well, I'm working on learning how to do interviews. And guess what? I'm done practicing interviews and I just had my first 2 real interviews. I go, wow. I said, that's phenomenal. They go, but I got 3 more because my goal is that I have to have 5 interviews that I've gone on. And then we're going to talk about how I'm doing. And the other thing is I talked with young children and they get refrigerator art, all right, where they get a handout, okay, with some crayons. And they get to talk about how they're doing and they can basically cover, it's almost like a graph where they can copy the graph with crayon, all right? Ownership is really important when it comes to goals and objectives. If somebody told you you are going to do this, then it's very likely, if you have no interest whatsoever, that whatever that is not going to get done. Right? And parents intuitively know this, they just sometimes don't want to recognize it. Right? So let's do a deeper dive into SMART objectives. You can write goals the same way. Goals tend to be a little bit broader. Objectives are our steps on how to get there. But either way, we can write both using SMART. So Nada, could I have the next slide, please? So how are SMART goals different? Most of us, if we're case managers, supports coordinators, and that learned how to do some of this either in our college program or in our internship. So SMART objectives are specific, they're measurable, and they're achievable. They're relevant, and they're timely. All right? So let's take a deeper dive. Nada, can we go on? Okay. We're going to watch a quick video on how to do goals, how to write objectives, and get results. Okay, so that was just a quick summary as to what SMART goals are, goals and objectives are. All right, so let's start our review, and then we're going to take some time to do some practice. All right, so we want things to be specific. All right, we want things to be measurable, and we're going to go deeper dive into all of these. So specific, set real goal measures and deadlines. All right, don't do generalities. Make sure your goal is trackable, measurable. And one thing about measurability is that we need some intermittent goals. If we were to do this by next year, by 10/1/25, that's a long time to wait, particularly if you are a family who has been trying to see some positives happening, if you're an individual who's been trying to achieve some goals, all right, they need some incremental types of objectives. Attainable, all right, within the sphere of influence, all right. If I were to say I want to be a millionaire by 1 year from now, okay, that's a great goal for me to have, but it is not attainable right now. Maybe I can be a millionaire by the time in my retirement package and all that, by the time I retire, but it's not right, not for 1 year. It's got to be realistic, attainable and realistic. All right. And it's got to be time bound. Once again, going back to specific and measurable, it's got to have a deadline, all right, that is reasonable and realistic. All right. Don't try to, make things too far in advance. People need to know what they've achieved, etc. So what we're going to do is do a deeper dive into each one of these. All right. So Nada, can we go on? Okay. So think about your own goals. If anything, take the goal that you just set for yourself and start working on it. All right. The first goal is to be specific. Okay. Who needs to be involved? What is trying to be accomplished? Where is there where is there relevance? Okay. If it's going to be at a site or somewhere else at the home, when, which, all right. Those are all some great words. In the video, they talked about starting off with action words. Action words are also great for resumes, all right? Increase, decrease, all right? Improve, options, all right? Words that are action-oriented, all right, are good ways to start goals. Increase the number of blah, 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 whatever that is. So we look at goals and objectives to be specific, right? So a non-specific goal is, I want to have a better life by next year. We need to start a drill down. What does that mean? All right. So Mada, next slide, please. So how is this goal going to be measured? In my goal that I put in chat for the big trip, I said that I'm going to have identified where I'm going and when I'm going to be doing it. So next year, I still have a big trip to go on this year. All right. So next year, just location and when. All right. So how will success be measured? 10/1 of next year, I want to know, all right, where I'm going on my next trip, all right, and when I'm going to do it. Okay. Now, measurability is a way of informing everybody. All right. It's informing everyone as to what needs to happen. It makes it more tangible. Okay. Yeah, I'm going to improve my social skills. That's not tangible. We might be able to see some effort, but we don't know when we see it. All right. We don't know how to tell that we've reached a certain level. The best thing to do with measurability is to have increments be more tangible, for lack of a better word, all right? So one thing that I do as a director of training is I work on big projects. So one of my goals for this coming year is to start a Docebo enterprise for SUD providers. Wow. I have a new manager coming on who's going to help me with that. But that is a big thing. That's a goal, but boy, it's a big one. So having things set up in smaller increments, all right, is really, really important. Mainly because I need to know and get some intermittent pats on the back saying, okay, I'm making progress. And so what measurability does for us is it tells us that we're making progress or if we're not, right? And it shouldn't be just me recognizing that. Everybody on the team should say, oh, look at that. Josh is making real progress. And we can tell that by the measurability of our objectives. Next one, please, Nada. So achievable and attainable. This is one of those areas where in our system, the behavioral health system for children and adults, and actually in the SUD system too, all right, is people come with pre-existing conditions, pre-existing considerations, pre-existing beliefs. Josh is really bad at school. He'll never be able to go to college, so why talk about it? All right. So very often our negativity about what people can achieve taints our writing of achievable goals. We won't want to get too lofty because Josh might not be, he's probably not going to be college material. All right. We don't want to be too lofty because he might not be able to work full time. All right. So when we are superimposing whether or not somebody can achieve a goal by coming in with pre-existing conditions, we're actually adding a lot of negativity. We want the goal or objective to be within the individual's capabilities, but we don't want to put a ceiling on it. All right. So sometimes we can say, Josh will have taken the first college class by this and this date. Not 5 years, Josh will have graduated from college. So we're basically making it within achievable, attainable. Josh is highly motivated right now. He really, really wants to get into that welding program offered at the community college. All right. And so the first thing he had to do was get into the school, and he achieved that. So now he needs to get through welding 101. Right? Now he needs to graduate from the welding program 3 years from now. So is it achievable? Is it attainable? Right? Look at things that are beyond people's control. All right? Are things going to impact him? Josh right now managed to get through a vocational program, get a scholarship for that welding program, that welding class. But he didn't get a scholarship for his entire 3-year program. So what are within Josh's control, and what else is there that is going to tell him that he needs to do some other objectives, have other objectives? Do they have the knowledge, the tools? And I'm going to keep repeating myself. One thing about setting goals and objectives is experience. And our young people lack experience in knowing what it's going to take to do things. All right. They don't think about the fact that, oh, so-and-so does this. But so-and-so had to do a lot of steps to get there. But what so-and-so does looks very appealing. But they don't have the experience to understand. So think about tools as being partially experience. Right? So tools, experience are some of how we gain some of our tools. If they don't have the tools, how are they going to get those? So it might be experience. It might simply be, hey, Josh, I have a good buddy who's a welder who said you can come and spend a couple hours with them. Do you want to do that? All right. Versus, hey, Josh, all right, in welding, it's a very dangerous profession. Do you know how to keep yourself safe? If not, let's start looking into that. But ultimately, whatever is about attainability, it needs to motivate and inspire the folks that we work with, all right? Not discourage them, right? So if mom's goal is Josh is going to get a job at McDonald's, and Josh's goal is to become a welder, it's not going to motivate him to work at McDonald's. Mom's goal is for Josh to have income, so he has some spending money, right? That's Josh's goal too, but they don't have the same path that they want to take. So achievable, attainable, all right? Try to look at it through the eyes or the lenses, all right, of the individual. Is working at McDonald's a stepping stone, all right, a short-term stepping stone, all right, to getting into something else? Or is it a destination in and of itself? If it's a destination in and of itself, it's not going to be motivation or inspiring. All right. I've been paying close attention to some of the political ads, and you'll notice for one of the candidates, they say, worked at McDonald's while going to school. All right. In other words, it was a stepping stone. It wasn't the destination. Right? So achievable, attainable. Right? Look at it through the lens of the person that for whom that is being written. So let's go on. Nadal, all right. Realistic and relevant. All right. All of these have the ability, all of these elements have the ability for negativity to be superimposed. All right. It can affect, that's not realistic, that's not achievable, you're never going to be able to do that. So when you are doing working on I pauses with people and you have a group of people there to talk, you need to have a mechanism by which you can control negativity. And maybe that is the first thing that comes out of your mouth, besides, welcome to Josh's iPods. Here, we are going to be talking about what is possible for Josh to achieve and what he wants to do with his life. All right. So therefore, we are not going to be putting negative slants on something. And inevitably, somebody's going to say, well, he needs to learn how to control his mouth before he'll be able to ever be in welding school. They're going to put a negative slant on it. And being able to say, all right, to turn those phrases around is a skill set that we all need to work on. Right? So is the goal relevant? Maybe a goal of working at McDonald's is the stepping stone. All right. But that relevance needs to be highlighted. Josh doesn't have that experience. He knows he doesn't want to work at McDonald's and he knows he wants to go to welding school. All right. And linking for him that his uncle owns the local McDonald's and can get him a job there as a stepping stone to the bigger goal is important. Right. So they need to understand how an objective may help reach that higher goal. Kids and adolescents don't know this intuitively. And to be honest with you, most of the kids that we work with don't have a huge number of positive role models. All right. So I want to share a quick story with you. In my previous home, which is over 10 years ago, all right, I lived across the street from a police officer. His name was Steve, is Steve. And he started on the force when he was 21. He got his 20 years in, all right, when he was in his early 40s and was able to draw a pension and leave the force. Basically, he retired at 42, all right, and he didn't know what the next step was for him. And he did the usual, well, I think I might get a job as a security officer because I can't sit home all day. And I'm like, Steve, I said, you are one of the perfect role models for adolescent boys. And he goes, no, I'm not. They hate me. I'm a police officer. I said, no, you're a successful man who has had a career, all right, and can be a positive role model. So he allowed me to nudge him, all right, in the right direction, all right, to become a big brother and then move on from becoming a big brother to really leading classes for adolescent boys, okay, about integrity and about who you are and about respect for yourself and respect for others, all right. And so 5 years later, he sees me again and he goes, this is the best career ever. And I'm like, wait a minute. Your career was being a police officer. Oh no, he goes, my career and my calling are to work with teenage boys. That's my career. And so, we need to realize that relevancy and realism, all right, is part of a process that kids need to understand, all right, and that there are stepping stones to getting certain places, all right. Just like Steve gained a lot of experience as a police officer, but found his calling in working with adolescent boys. All right. And so it was about a year ago, I go to my city council meetings. I'm sitting in city council and I see Steve come in and he's got 4 teenage boys with him. And he was addressing the city council. And each one of those boys, all right, had a part in this presentation and were incredible at basically saying, this is what I am hoping to achieve. And what they were asking for was for city council to allocate money towards a program, which by the way, they got. It wasn't a huge amount. They wanted $15,000 and they got that. All right. But the relevancy, we don't know, for many child and adolescents, we don't know what the realism is yet. We don't know what people can achieve. And holding them back is not going to help. Right? So Nada, could I have that last slide, please? Timely. All right. Now, timeliness is very, very important, especially to Medicaid, which pays for a lot of services. All right. So we know as professionals that we need to have goals that are measurable and timely, that can be reported out on, all right, on, quarterly reports and annual reports and, all the different reports that we have to do. So timeliness is very relevant to us as professionals, right? It's equally relevant to the families and the kids that we work with. How else are they going to know if they're making progress? And how are we going to know if something might not be exactly the way it needs to be? We've been trying something a certain way. That objective is not working well. We need to step back, do an amendment, twist it a little bit, and start and continue on, or even start over. So we have short-term and long-term objectives. All right. So I find objectives to be timely. When I find objectives to be timely, I say good for the person served and good for the family. But I also have to say good for our funders, right? Because our funding is really, really important, right? So think about, whether or not your imposed timing quarterly. We tend to think in quarters, quarterly, semi-annually, annually. All right. But is that enough? Or do we need to have a check-in once a month? All right. Do we need to reevaluate how we're doing with our master plan? All right. Do we need to reevaluate that every 6 weeks? All right. So when you look at, if you have a goal or an objective that is a year long, you need to have some sub-objectives that look at incremental, all right? Incremental success. You don't want to tell me that I'm being successful, all right, a year after I've started it. You want to be telling me, all right, that I'm being successful much more frequently. And if I'm not being successful, we need to tackle that and figure out why together and figure out the changes that have to be made through something called an amendment. So with that said, all right, I am going to, hold on, let me see where I am at here. All right. So before we move on to the next slide, okay, this is fine, Nadine, let's leave it up there. I want to hear from you in chat. What do you find are your biggest challenges? Or you can just simply unmute yourself and share. What are the biggest challenges when you're working with families and working with kids and adolescents and helping to identify goals and objectives? So think about that. You can put in more than one thing, right? So while you're doing that, one of my biggest challenges in my career, and I've been a social worker now for 30 some years, all right? One of my biggest challenges is to help people have a vision for the future. Many of the folks that I worked with, they had lived in poverty, all right, in poor housing all their lives, and really had no idea on what the possibilities were. So my struggles were always helping people find the vision. Brittany says sometimes they don't recognize their own strengths, right? Not recognizing their own strengths can be for a variety of reasons, and one of them might be because you've been put down. Everybody sees you as a loser as opposed to as a winner, right? Getting Beverly wrote, getting the family to see their strengths because they aren't used to seeing themselves in a positive light. So not only do individuals feel that, the kids and adolescents that we work with, but also the families that we work with. Maybe they've been stigmatized. Maybe they've been discriminated against. Maybe they spent, the last years in poverty and are worrying more about where the next meal's going to come from as opposed to what's going to happen to Josh when he turns 18. Right? What else? Come on, let's get some other ideas out there. I see some other people are typing. How to make it measurable. Yeah, we're going to practice that. How do we achieve measurability? Well, part of measurability is that feelings, all right, and emotions cannot be measured. Behaviors and observables are measured. And so sometimes when we use the word like Johnny will not feel so sad all the time, and we're not sure exactly what that means, then we have to give it a name. We have to name what behaviors that we're seeing. All right. So if Johnny's not going to be so sad, right? First of all, we have to ask ourselves, how is Johnny expressing sadness now? Johnny has frequent bouts of crying, right? When somebody says something negative to him, He runs away. When his brother is being mean to him, he expresses the sadness in terms of pushing his brother away. So in terms of measurability, we have to look at, we can see things that are measurable. We can't feel things that are measurable. So we have to ask ourselves, if we're dealing with something that is more emotional, then we need to ask ourselves, what are the behaviors that we're seeing? All right. So Johnny will dress appropriately for work. Right? Nadab, do we want to put them in breakouts to do this, or?
I thought we have breakouts coming later when we have the 3 different scenarios.
Okay. All right, then let's go ahead and do that then. So Johnny will dress appropriately for work. All right, put in chat. All right, put in chat, what word do you not like in this sentence? Will, okay. What else? Appropriate, yep. So Johnny will dress appropriately for work. What does appropriate mean? Does appropriate mean that you've got jeans on that hang off your hips and show your underpants? Or does appropriate mean that you're wearing khakis with a tucked in blue shirt and a belt? All right. So Nadal, let's take a look at what we have in comments on this. They're not specific or clear. Okay. This is appropriate dress is dependent on the type of work setting and the individual's interpretation. There's no measurement to quantify the progress. Okay. And attempts at evaluation will be very subjective. Okay? So Johnny might say, all right, Johnny might say, can we go back one more? So Johnny might say, I was appropriately dressed. My clothes were clean. I took them out of the hamper, washed them last night, and they came out of the dryer this morning and they were clean. So Johnny's interpretation of appropriate is clean clothes. All right. But the fact that he works for a place that requires a uniform doesn't necessarily mean that he was appropriately dressed. Maybe he works for a place where tennis shoes are not allowed, or where you have to wear closed-toe shoes. All right. So is this a well-written objective? No, it's not. Okay. So what I would like to do now is, before we move on, I would like to take another break. It is 11:19. We'll take a 10-minute break and come back at 11:30. All right. So right now, what we're going to do is we're going to practice SMART goals. And you're going to be divided up into 3 groups. And each group is going to have one statement that they have to turn into 2 or 3 SMART goals. And you're obviously going to know that they're not very good SMART objectives or SMART goals to begin with. So what we want you to do is to take what we're going to give you, and I'm going to tell you, all right, and turn them into 2 or 3 objectives that are SMART. All right. So I need you to write these down. So find a place, piece of paper, write these down. So Sally, ready? Sally says, I want to stop getting in trouble for being disrespectful to my math teacher. Sally says, I want to stop getting in trouble for being disrespectful to my math teacher. And I'll give it to you one more time. Sally says, I want to stop getting in trouble for being disrespectful to my math teacher. So when you go into groups, if you're in group 1, you're going to pick that one up. Now, Mary says something different. Mary says, I want to get along better with my younger siblings. Mary says, I want to get along better with my younger siblings. One more time. I want to get along better with my younger siblings. So if you're in group 2, you're going to tackle that one. And finally, group 3 has Jay. Jay says, I want to do my chores at home to earn more privileges. Jay says, I want to do my chores at home to earn more privileges. One more time. Jay says, I want to do my chores at home to earn more privileges. Has everybody got those? All right. So what's going to happen now is I'm going to open up the breakout rooms. You're going to see a room that you're in, room 1, 2, or 3. Room 1 is going to do Sally, room 2 is going to do Mary, and room 3 is going to do Jay. And your task is to write 2 or 3 SMART objectives to share with the group. So you might want to determine a spokesperson from your group. Otherwise, I'll just pester all of you, okay? All right, so here you go. You're going off into groups now.